Did you know that 1 in 3 people will develop cancer in their lifetime? How many times do we ignore small symptoms, thinking they are just passing things? What if some of these signs are the wake-up call that could save your life? Cancer is one of the leading causes of mortality in the world, but here's what many people don't realize. Early diagnosis can make all the difference between life and death. According to studies, when identified early on, many types of cancer have survival rates greater than 90%. But if the disease is discovered too late, that number could drop to less than 20%. And that's exactly what happens to millions of people every year. The subtle signs are there, they simply go unnoticed. In this video, you will discover 11 alerts that your body may be giving right now. These are signs that may seem harmless, but that can make all the difference between efficient treatment and late diagnosis. So stay tuned, because this information can save your life or the life of someone you love. Let's get started. The shocking truth about cancer that almost no one knows. Cancer is one of the most feared diseases in the world, but the truth is that many people are unaware of essential information about it. Most believe that cancer comes on suddenly, without warning. But this is not true. In fact, the body usually shows signs long before the disease manifests itself in advanced stages. The big issue is that almost no one pays attention to these subtle signals. Another shocking fact is that many forms of cancer can be prevented or treated early with simple lifestyle changes and regular checkups. However, the lack of knowledge causes millions of people to be diagnosed too late, drastically reducing their chances of survival. Knowing how to identify the first symptoms can make all the difference. And now you'll find out what warnings your body may be giving you and how to act before it's too late. 11 alerts your body may be giving you right now. 1. Bone pain that doesn't go away, a silent warning that can be serious. Bone pain is common, especially as we age or after intense physical activity. But what many people don't know is that persistent bone pain can be one of the first signs of cancer. Unlike transient muscle pain, this pain does not improve with rest or common painkillers. It may start discreetly, seeming only a mild discomfort, but it intensifies over time. Cancer can affect bones in 2 ways: through primary bone cancer, such as osteosarcoma, or through metastases, when cancer from another organ spreads to the bones. In both cases, the most common symptom is a deep, persistent pain that worsens at night or when the body is at rest. Often, this pain is confused with arthritis or joint inflammation, causing the diagnosis to be delayed. In addition to pain, bone cancer can cause swelling, difficulty moving, and, in more advanced cases, spontaneous fractures. This happens because the tumor weakens the bone structure, making it more susceptible to breakage, even without significant impacts. If you've been experiencing bone pain for weeks without an apparent cause, especially if it's accompanied by swelling or weakness in your limbs, don't ignore it. Regular medical appointments and imaging tests, such as X-rays and MRIs, are essential to rule out serious problems. The good news is that, when identified early, bone cancer has a good chance of treatment. So if your body is sending this signal, pay attention. Pain can be an early warning of something that deserves immediate attention. 2. Eye pain and vision changes. Your eyes may be trying to warn you. Our eyes are windows into the health of the body, but few know that changes in vision can be an early sign of cancer. Many people associate eye problems with tiredness, age, or excessive screens, but some changes can indicate something much more serious. Eye cancer, like eye melanoma, can develop silently, and when caught too late, it can compromise not only vision but also the patient's life. One of the first signs is persistent pain in the eyes, which does not improve with rest or common eye drops. Another worrisome symptom is blurred vision or dark spots that appear to float in the field of vision. In some cases, the person may notice unexpected flashes of light or a growing shadow covering part of the vision. Another warning sign is the appearance of a dark spot on the iris, which can increase in size over time. While many of these changes may be related to less serious problems, such as ocular migraine or retinal detachment, any sudden change in vision should be evaluated by a specialist. People with fair skin or lighter colored eyes are at a higher risk of developing eye melanoma. In addition, excessive exposure to the sun without adequate protection can increase the chances of this type of cancer. The best form of prevention is to have regular eye exams. The fundus exam can detect suspicious changes even before noticeable symptoms appear. If you are experiencing persistent pain in your eyes or have noticed changes in vision that do not go away, see an ophthalmologist as soon as possible. Remember, when cancer is identified early, the chances of successful treatment are much higher. Never ignore the signals your body is sending. 3. Rashes that look harmless but high danger. Our skin reflects a lot about our health, but we don't always pay attention to the signals it gives us. A simple rash may seem like something common, like an allergy or irritation, but in some cases, it can be one of the first signs of cancer. Skin cancer, such as melanoma, basal cell carcinoma, or squamous cell carcinoma, can start with small changes that go unnoticed. A rash that doesn't go away, that changes color, or that itches and bleeds can be an important wake-up call. Unlike temporary irritations, these lesions do not heal and can grow over time. Another worrying sign is small red or purplish spots on the skin, which appear for no apparent reason and do not disappear. In some cases, rashes associated with leukemia can arise due to problems with blood clotting, leading to the appearance of small spots known as petechiae. Unlike a simple insect bite, these spots do not disappear when pressing on the skin. In addition, some forms of lymphoma can cause intense itching of the skin without any visible lesion at first. This symptom is often ignored or treated as a common allergy, delaying the correct diagnosis. Excessive exposure to the sun, family history, and even contact with chemicals can increase the risk of skin cancer. Therefore, it is essential to observe any change in the body and seek a dermatologist if something unusual arises. Dermatological examination and biopsy of suspicious lesions are essential to confirm or rule out skin cancer. The good news is that, when detected early, skin cancer has a great chance of cure. If you notice a strange rash that doesn't get better over time, don't ignore it. The simple habit of observing your skin can be the key to an early diagnosis and successful treatment. 4. Dark spots and streaks on your nails. A sign that few notice. Our nails can reveal a lot about our health, but most people only pay attention to them when they break or become weak. However, subtle changes in nail color or texture can be a silent warning for something much more serious. Subungual melanoma, a rare type of skin cancer that affects the region under the nails, usually begins with a dark spot or vertical stripe that extends along the nail. Unlike marks caused by trauma, this color does not fade over time and can gradually increase. Another worrying sign is the so-called Hutchinson's sign, when dark pigmentation spreads to the skin around the nail. This characteristic is a strong indication that the lesion may be malignant and needs immediate medical evaluation. Subungual melanoma can affect both the fingernails and toenails and is most common on the thumb or big toe. Often, people confuse this change with a fungus or a spot caused by knocks, delaying the correct diagnosis. In addition to the color change, the nail may begin to crack, detach from the skin, or even present small bleeding for no apparent reason. Factors such as unprotected sun exposure and a family history of skin cancer can increase the risk of this type of tumor. It's essential to observe your nails regularly and see a dermatologist or oncologist if you notice any persistent changes. The clinical examination, combined with a biopsy of the affected region, can determine if the spot is benign or a melanoma. The good news is that, if diagnosed early, subungual melanoma has a high chance of being successfully treated. Don't ignore changes to your nails. They may be trying to warn you of something much more serious than you think. 5. Intense night sweats for no reason. Your body may be fighting something serious. Waking up sweating occasionally can be normal, especially on hot nights or after a tiring day. But when night sweats happen repeatedly, soaking your clothes and sheets without any apparent explanation, it can be an important wake-up call from your body. This symptom can be related to different diseases, but it can also be one of the first signs of some types of cancer, such as lymphoma and leukemia. Lymphomas, which affect the lymphatic system, can cause intermittent fevers and intense night sweats, even when the environment is cool. This happens because the body is trying to fight cancer cells by activating defense mechanisms that dysregulate body temperature. In addition to sweating, other symptoms often associated with lymphoma include extreme tiredness, weight loss for no apparent reason, and itchy skin. In leukemia, excessive sweating can be the result of the uncontrolled action of cancer cells in the blood, which overload the immune system. Many people ignore this symptom because it may seem harmless, such as a side effect of stress or eating. However, frequent night sweats that are accompanied by other signs, such as fever or swollen lymph nodes, should be investigated. If you notice that you are sweating excessively at night for no apparent reason, even in a cool and comfortable environment, it is time to see a doctor. Blood tests and lymph node biopsies can help identify if there's something wrong with your immune system. The good news is that, when diagnosed early, many cases of lymphoma and leukemia have effective treatments, significantly increasing the chances of recovery. Don't ignore this symptom. Night sweats can be one of the first alerts that something is wrong in your body. 6. Constant heartburn that doesn't get better can be much more than a nuisance. Occasionally experiencing heartburn after a heavy meal is common, but when burning in the stomach and throat becomes frequent, even with changes in diet and use of medications, it can be a warning sign. Chronic gastroesophageal reflux can cause irritation in the esophagus, and in some cases, this inflammation can lead to a condition called Barrett's esophagus. This change in esophageal cells significantly increases the risk of developing esophageal cancer over time. Esophageal cancer is often silent at first, manifesting itself only by symptoms such as persistent heartburn, difficulty swallowing, and a feeling of food stuck in the throat. In addition, unexplained weight loss, chest pain, and prolonged hoarseness can be other worrying signs. Many people believe that heartburn is just a digestive problem and try to control it with home remedies or antacids. But if symptoms persist for weeks or months without improvement, it is essential to seek a detailed medical evaluation. Tests such as endoscopy can identify inflammation in the esophagus and detect early cellular changes before cancer develops. People who consume alcohol in excess, smoke, or have a history of reflux are more prone to this type of complication. The good news is that early detection of esophageal cancer can allow for effective treatment, increasing the chances of recovery. If you experience constant heartburn and have tried several solutions without success, don't ignore this symptom. It can be much more than just digestive discomfort. Your body may be trying to alert you that something more serious is going on. 7. Yellowish skin. Jaundice. If your eyes are yellow, pay attention. The skin and whites of the eyes can reveal a lot about our health. If you suddenly notice that your skin or eyes are turning yellow, this could be a warning sign that shouldn't be ignored. This yellowing, known as jaundice, happens when there is an accumulation of bilirubin in the blood, a substance produced by the liver. In many cases, jaundice can be associated with liver diseases such as hepatitis or cirrhosis, but it can also be one of the first signs of pancreatic or liver cancer. Pancreatic cancer is one of the most aggressive and, unfortunately, is often only detected in advanced stages. This is because, at first, it may not cause pain or obvious symptoms. When the tumor grows and blocks the bile ducts, it prevents bile from being eliminated properly, leading to the accumulation of bilirubin in the body. In addition to yellowing skin and eyes, symptoms may accompany jaundice, such as dark urine, whitish stools, severe itching, and unexplained weight loss. Many people ignore these signs, believing that it is just a bad diet or lack of hydration. However, any change in skin or eye coloration should be investigated immediately. Blood tests and ultrasounds can help identify the cause of jaundice and determine if there is a more serious problem behind this symptom. If cancer is detected early, the chances of successful treatment increase significantly. The best way to avoid complications is not to ignore the signals that the body sends. If your eyes or skin have started to turn yellow, see a doctor as soon as possible. It could be an early sign that something serious is happening internally. 8. Frequent fever with no other symptoms. Your immunity may be sending you a signal soon. Fever is a natural response of the body to fight off infections, but when it occurs repeatedly for no apparent reason, it can be a warning sign. Many people associate frequent fevers with colds or flu, but if your body temperature rises constantly without the presence of other symptoms typical of these diseases, it is essential to investigate further. Diseases such as leukemia and lymphoma can cause persistent fevers, as they directly affect the immune system and the production of blood cells. In the case of leukemia, cancer cells prevent the healthy production of white blood cells, leaving the body vulnerable to constant infections. Lymphoma, in turn, can cause intermittent fevers, as the body tries to fight the presence of tumor cells in the lymphatic system. What differentiates the common fever from a fever associated with a possible cancer is its recurrence and duration. If the fever persists for more than 2 weeks, appears cyclically, or is accompanied by intense night sweats and unexplained weight loss, attention should be redoubled. In addition, this fever can be low, ranging between 37.5 degrees and 38 degrees, which causes many people to ignore it. Another worrying sign is when the fever appears without typical symptoms of infection, such as sore throat, cough, or runny nose. If the body is raising its temperature without a clear cause, it may be trying to warn of something more serious. Blood tests can identify changes in white blood cells and detect possible abnormalities in the immune system. Early diagnosis is essential to increase the chances of effective treatment. So if you have had frequent fevers without explanation, do not ignore this symptom. Your body may be trying to warn you of something that needs to be investigated as soon as possible. 9. Extreme tiredness that doesn't get better with rest. When fatigue can be a serious wake-up call, feeling tired after a long, stressful day is normal. But when fatigue becomes constant, intense, and does not improve with rest, it can be a sign that something more serious is happening in your body. Extreme fatigue is one of the most common symptoms of several types of cancer, especially leukemia, lymphoma, and colon cancer. This is because cancer can interfere with the production of healthy blood cells, reducing the amount of oxygen that reaches the body's tissues, and causing a feeling of persistent exhaustion. In leukemia, for example, abnormal production of white blood cells can lead to anemia, resulting in extreme tiredness, dizziness, and shortness of breath. Lymphoma can also cause intense fatigue, as the immune system works excessively to fight cancer cells. In colon cancer, fatigue can be associated with internal bleeding, which leads to gradual loss of iron and the development of silent anemia. Many people ignore this symptom, attributing it to stress, a busy routine, or a lack of adequate sleep. But if the tiredness persists for weeks and is accompanied by other signs, such as unexplained weight loss, fever, or paleness, it is essential to seek medical help. Blood tests can identify changes in hemoglobin and white blood cell levels, helping in the early diagnosis of possible diseases. In addition, changes in diet and lifestyle, when they do not solve the problem, can be an indication that fatigue has a deeper cause. If you feel exhausted even after a good night's sleep and can't find a logical explanation for it, don't ignore this symptom. Your body may be warning you that something isn't right and that a medical evaluation is necessary. 10. That take time to heal. Is your body having trouble recovering? Small cuts and wounds usually heal quickly, usually within a few days or weeks, depending on the depth of the injury. But what about when a wound doesn't seem to close, remaining inflamed, bleeding, or increasing in size over time? This can be a warning that something more serious is happening in your body. Healing difficulty can be related to different conditions, such as diabetes and nutritional deficiencies, but it can also be one of the first signs of skin cancer or other types of malignant tumors. Basal cell carcinoma and squamous cell carcinoma, two of the most common types of skin cancer, often begin as small wounds that do not heal. These lesions may bleed occasionally, crust over, and then open again, an unusual behavior for normal wounds. In addition, persistent sores in the mouth or lips can be an early sign of oral cancer, especially in smokers and people who consume alcohol regularly. Another worrying factor is the presence of wounds in regions of the body that do not suffer constant friction and still take time to heal. This may indicate a compromised immune system, as occurs in cases of leukemia, where inadequate production of white blood cells affects the body's ability to fight infection and repair tissues. If you've noticed that a skin sore or ulcer persists for more than 4 weeks with no signs of improvement, see a dermatologist or medical specialist. A simple biopsy can determine if there are cancer cells in the region and allow for an early diagnosis. The good news is that, when detected early, most skin cancers have a high chance of cure. So don't underestimate wounds that seem harmless. They may be sending you a warning sign for something much more serious. 11. Hoarseness or changes in voice for more than 2 weeks. A worrying sign that many overlook. Being hoarse after yelling, singing, or talking for long periods is normal and usually improves with vocal rest. However, when hoarseness persists for more than 2 weeks without an apparent cause, it can be a sign of something much more serious. Laryngeal cancer and other forms of cancer in the throat region can begin with small changes in the voice, often ignored or attributed to passing infections. This is because tumors in the larynx or vocal cords directly affect the vibration and functioning of the voice. In the early stages, the person may notice a harsher, weaker, or hoarse voice, with no signs of improvement over time. In addition to prolonged hoarseness, other worrisome symptoms include pain when swallowing, a feeling of something stuck in the throat, and persistent coughing. In more advanced cases, the person may even notice difficulty breathing or nodules in the neck, indicating that the cancer may have spread to the lymph nodes. Smokers and frequent alcohol consumers are in the highest risk group for this type of cancer. Long-term exposure to chemicals and gastroesophageal reflux can also increase the chances of developing tumors in the larynx. The good news is that when diagnosed early, laryngeal cancer can be treated with high success rates, avoiding more serious complications. If you have had an altered voice for more than 2 weeks and no signs of improvement, see an otolaryngologist for an evaluation. Simple tests, such as laryngoscopy, can detect suspicious changes and allow early treatment. Never ignore changes in your voice. Your body may be trying to warn you of something that needs to be dealt with before it's too late. Most people only see a doctor when symptoms are already advanced, but the truth is that cancer can be silent at first. These 11 signs may seem harmless, but ignoring them can cost you precious time in diagnosis and treatment. Early detection is the greatest ally in the fight against cancer. Studies show that when the disease is identified in the early stage, the chances of cure are much higher, reaching more than 90% in some cases. If you have noticed any of these signs in your body, do not ignore it. It doesn't mean you have cancer, but it does mean your body is trying to tell you something. Make an appointment, get exams, and ask your questions with a health professional. Taking care of your health today can save your life tomorrow. Also, share this information with friends and family. Many people have no idea that small symptoms can be an important wake-up call. Information saves lives. And now that you know these signs, you can help not only yourself, but also those around you. Your health is worth every minute of your attention.